OCU410 Geographic Atrophy secondary to dry age-related macular degeneration. There was a phase 1 phase safety and tolerability study that we conducted, as well as phase 2 efficacy, and we have completed the enrollment recently as well, ahead of the time, a quarter before the company has committed to the market. What does it mean? What is OCU410? OCU410 ST and OCU410 GA, same product with the ABCA4 model, unique four-way mechanism of action, which means OCU410 is uniquely placed as compared to the approved products that we have it in the market, that is Syfovre and Izervay. If you look at the safety profile or the package inserts of the approved therapies, there are cases of ischemic neuropathy, there's CNV, endophthalmitis, vasculitis. However, there are no serious adverse events reported related to OCU410 GA in all 60 patients till to date. We had a typical 3+3 design for phase 1, which was in low dose, medium dose, and high dose cohort. We dosed 9 subjects over there, and 51 subjects in a 1:1:1 design, which was 17, 17, and 17 subjects were dosed in a single subretinal injection as a single one-and-done treatment for patients 50 years of age and older. Not only that, this particular treatment includes geographic atrophy lesion in the inclusion criteria as 2.5 to 20.5 millimeters square, which was more than a disc area. We had also not excluded any of the patients that were CNV or having CNV, so we had not even a single case of CNV in the trial as well. When you look at the data of the published data for the approved trial, there is not much on the improvement other than the lesion size. Our clinical and scientific community, we saw that there is a 41% reduction from the baseline at month 12 for these patients. And just to let you know that these are the patients that got one and done single treatment for life, that's a subretinal injection. Subretinal injection was given in the center of the macula, in the supratemporal, infratemporal region, and multiple blebs were created, and there was no foveal detachment. We established the maximum tolerable dose from phase 1, and phase 2 we went through medium dose and higher dose and a control. So the efficacy is around multiple dose concentrations. Not only that, if you look at the approved products and the OAKS and Derby trials, the data suggests that the safety profile of those approved products, there was a progression of 12% to wet AMD cases. We have not seen a single case of wet AMD due to the investigational product here in the trial, which also is a testament that the RORA gene is a powerful gene, is a novel modified gene therapy platform that uniquely works on the four-way mechanism of action. Not only that, there was a 3-month washout period with the injections, that is intravitreal injections for Syfovre and Izervay. If you look at Syfovre and Izervay, they are given intravitreally 6 to 12 times a year, and it is quite cumbersome, and there is compliance issue for the patients in terms of getting those treatments. And of course, safety and tolerability becomes a question as well. In terms of geographic atrophy secondary to dry age-related macular degeneration. Geographic atrophy is the advanced case of dry age-related macular degeneration, and also it impacts the elderly population, impacting their quality of life, such as driving or doing the daily activities. The data that we have recently released also has some functional outputs, not only on the structural lesion growth reduction, but also on the low luminance visual acuity, which means that under low light conditions, the LLVA, we saw a gain of up to 4 lines or like up to 20 letters or more change from baseline as well. Also, we in terms of the retinal sensitivity, we have seen that over the period of almost 9 months, the patients were able to preserve the retinal sensitivity around the GA lesion area as well. And we have included both foveal and parafoveal lesions in this trial, and we are moving as a company to phase 3 after our follow-up for phase 2 patients will be done. And I hope that this, as there is no approved product in Europe as of right now, this due to the limitations on the current approved products, as they are only approved in terms of structural reduction, but not on the quality of life or the functional outcomes that they're seeing. We are hopeful that this LLVA data that we have released is promising and is trending in the positive direction that would put place OCU410 GA to be the future, I would say, approved product in Europe as well. In summary, OCU410 GA could be the potential one-and-done treatment for dry age-related macular degeneration and geographic atrophy, as there are 1 million patients in US and almost 5 million worldwide that are suffering from this disease. The unique four-way mechanism of action of OCU410 GA would take this potentially sooner to the market and improving not only the structural as well as the functional outcomes in these patients. I also believe that with the strong preliminary data, this particular product can go to Europe and address the functional parameters and outcomes in the patients that are looking to improve their daily quality of life.